If anyone can just reply on chat, then we will start. Yes, okay, great. So good evening, everyone, and thank you very much for attending the webinar today. Today's webinar is being organized by Clean Middle East in association with Boecker, and the topic is the best practices in food safety. At a time when the HORECA sector has taken such a huge hit due to the COVID-19 pandemic the world over, it has become even more imperative that this industry understand the intricacies of the virus and how it can impact any food retail establishment. In fact, people who have been in lockdown or self-quarantined will probably think 10 times before venturing into any restaurant. So this webinar is to understand, a couple of points. Number one is what kind of measures must the HORECA sector take to ensure zero risk of contamination, prevent cross-contamination both between patrons, between staff, and between the patrons and staff. Ensure that the food that is served is done so safely, right from the handling to the serving, and keep the customer happy and safe overall to provide an ambience that is safe as well as luxurious, which is what the customer is seeking as well. So to understand this, Clean Middle East, in association with Boecker Middle East, with Boecker International, is organizing this webinar on best practices in food safety. Before we proceed, let me introduce you to our speakers today. So we have with us Hala. She is the group food safety manager at Boecker. She is a certified trainer for food hygiene, HACCP and ISO 22000 trainings, and she's a consultant for food safety management systems with 15 years of experience in ISO 22000, FSSC, HACCP or HASP, BRC, and Global Gap. We also have with us Dr. Shabrinath Srikumar. He is the assistant professor at the Department of Food, Nutrition and Health at the College of Food and Agriculture, UAE University. He has a PhD in fishery microbiology and has trained in bacterial function genomics at the J. Hinton Laboratory at the Trinity College in Dublin. And he's also done research in food safety at the Seamus Fanning Laboratory at the University College Dublin. At UAE University, he teaches different courses associated with food science. So welcome, Hala and Dr. Shabrinath. Thank you so much for being part of our panel discussion today.
Thank you.
Thank you. Thank you so much.
So we will start quickly with the first question. Okay, so, we will start with the first question. How has COVID-19 changed the concept of food safety overall? Any of you could start off.
May I go?
Yes,
May I start?
Please.
Okay. So let's say we do definitely have a big change when it comes to food safety. Yet, food safety by itself is concerned about much more than COVID-19. So the positive point about COVID-19 when it comes to food safety, it's like through food, we cannot get the COVID-19. This is a good thing for us. We're heading now in a new era that we are calling the new normal. People will go out again, everything is opening again, which is good for us because after this paralysis we've been through, we are thrilled to go back to the hotels, to the restaurants, to live again. Yet it's not gonna be our normal life. It's gonna be our new normal life. And people are worried, which is 100% understandable to be worried because we are still not sure that the virus is still around us. There is no vaccination so far, so it doesn't mean it's over. Yet we opened, but we did not finish. So the food sector, the hospitality business should be careful. Yes, we cannot get it through food directly, but we do have other aspect that we need to worry about: the food handlers, the contractors, the suppliers, the guests themselves. So the surrounding areas, the highly touched surfaces. That's why we have a set of guidelines that definitely will appear in other questions now. A lot of things that we need to worry or put in place. Let's remove the word worry, to put in place, to abide by, to have a successful and experience for the guests. You will be happy, they will come, they will eat, they will enjoy their nights. They should not fear visiting restaurants, and they should have a happy experience, because sitting in a restaurant as well and feeling there is something wrong around you, or too much, I would say, restrictions is also not good for the guests. We don't want them to feel that much. So we will see later on what to do for them to have a nice experience.
Yes, I agree with Ms. Hala completely. It is a very good. I will start by a quote. We normally say, "Whatever happens, happens for the good." So even the COVID-19 situation, taken from a food safety perspective, it will add it in a positive way, because we have to implement strategies to avoid COVID-19 infections and transmission, and preventive control strategies, which will essentially will be beneficial from a food safety perspective. Let's take an example, say norovirus. The norovirus is a gastrointestinal virus, now otherwise called as winter bug. So if any food handler is having norovirus, if he coughs or sneezes, the droplets will drop in the food and gets transmitted. So in this scenario, in COVID-19, the new normal, as Ms. Hala was mentioning, if the food handler is wearing a mask, then the transmission process of norovirus is less. I mean, this is an added advantage for food safety, wearing gloves or social distancing, which we'll be discussing in a much greater depth, I guess, through this process. So all these processes will augment or will help in a positive way to ensure food safety. That is my opinion.
So then, if you're talking about that, there are, like Ms. Hala mentioned earlier, that a lot of people think that coronavirus is, you know, rather it has been established that it is not it does not get cross contaminated through food. Is there any other myth currently that people are having around COVID-19 and food, if at all?
Yes, a lot.
Please.
We do have actually a lot of misconception. The first one, as we said, it's, can we have it through food? No, we cannot have it through food. So it does not even multiply inside food. It needs a living cell in order to multiply. So it's inside the human body. So that is on the side. Even if you have it in food and you cook it properly, which is one of the main requirement of food safety, cooking food above 75 degrees Celsius, for example, you are destroying the virus. We have a lot of other misconceptions linked to it, or people telling you add pepper to your food, it will actually remove the coronavirus, which is not true, or ginger or garlic, or eat that type of food. Now, definitely eating healthy is something that we ask from people on day to day. Eating healthy is not only concerning we need to eat healthy for having a proper diet, for any other reasons, but not linked to the COVID-19 virus itself. Drinking water will wash out the virus. No, but you need to drink water. This is a requirement as well from a healthy diet. So we heard a lot, and if you check the WHO, they even have a specific link for the myths and the facts on the COVID-19 and food, because we heard a lot of this. So we are trying to educate people, and we are asking them actually to fight this virus by knowledge and not fear. The more we know about it, the better our life will be.
I'm not able to hear you. Sorry. I think you're mute, Ms. Shanti.
Sorry, I'm on mute. I'm sorry. I wanted to say, do you have anything else to add to this?
Yes, currently there are many myths surrounding the COVID-19, not essentially linked to food safety. I mean, this is from a general perspective. One thing which let's start from what we all know. Like, for example, COVID-19, not all cases are symptomatic in nature. Many cases, a large percentage is asymptomatic. That means me or you or whoever who does not exhibit any visible symptoms are transmitting the virus. We don't know. And then the other common myth is like, okay, the youngsters can say, okay, my immune system is very healthy, so I will not contract the virus. But no, that is not the case. I mean, yes, the severity of the disease in an immunocompromised patient or an elderly, for elderly people are much higher. At the same time, we can see that many fatalities is associated with young people. And another myth is the COVID-19 situations will, or COVID-19 transmission will reduce over summer, which is again a myth, because this virus is known to survive and replicate at temperatures above 25 degrees, so summer does not affect it. Drinking a lot of, as Ms. Hala was mentioning, drinking a lot of hot beverages can reduce COVID-19. No, that's not the case. But again, all these food like ginger, garlic, etc., it does not keep us away from COVID-19, but it will help us to develop an immune system to resist COVID-19 if we are exposed to it.
Okay. Yeah, in fact, I'm living in India right now. So during the entire lockdown period, I've been here, and we are known to depend on our ancient, ancient medicine and ancient strategies to build immunity. So a lot of people are talking about having warm liquids, having different kinds of like you mentioned, ginger or turmeric or stuff. But like Ms. Hala said, absolutely no, it's not going to prevent. It's not going to kill the virus, or it's not going to not allow the virus it's going to sorry, it's going to prevent the virus from probably attacking you as strongly as it would have if you had not built your immunity, but it's not like you're completely safe, right?
Just if you go and show yourself some sunshine, basically, it's not going to keep you away, but it will give us vitamin D, which will give immunity, basically. So it will help us to fight the virus, but not preventing it. Yeah,
Kill it. Yes, yes, absolutely. Absolutely. So then what kind of steps, in fact, we've had a question there as well. Ms. Megha says, how can hotels or catering companies remove these myths and make people safe to come to their facility? So we can add to that, and also talk about what steps they must take before opening up their facilities.
The pre-opening, actually, every hotel or restaurant, they should have what we call a pre-opening checklist. Specifically, after this lockdown, they closed for a while. Now, maybe some of them, they were still operating through delivery services, but others, they were completely shut down. So the first thing to do, you need to come back to your kitchen and have like a proper and detailed look. What about our ventilation system? Is it still working? Do we need a deep cleaning? What about the freezer, the chillers, the temperature? Is it still working properly? We need to do a proper cleaning for the surfaces. Everything should go back to normal, and new normal for sure. Again, this is our trend now. We are using everywhere. We're checking our facilities step by step before opening our kitchen. And then the second thing we need to do is actually to train the food handlers. Because as we know, as like say food safety specialists, the first thing we need to do is to evaluate the hazards and check from where we can have it. The main source of COVID-19 is people. So this is the source of COVID-19. So we need to educate our food handlers, explain to them what to do in turn to avoid this transmission. And here we talk about PPEs, the mask, the gloves, the let's say the hygienic practices, the identification of the symptoms, the checking the temperature. So all that should be first transmitted to the food handlers for them to be aware of this, and then it will escalate to contractors, to supplier by proper guidelines inside the restaurant or the hotel as well.
Correct. Dr. Shabrinath, anything else that you'd like to add?
Yes, I have some points. I was waiting this question, so I have made some points which I think is worth notable. First of all, I think before opening any facility, all the employees have to be tested. Employees have to be tested for the COVID and for the symptoms or asymptomatic, whatever tests that are available. There are many tests that are available right now. And whatever the government stipulates, following the health regulatory agencies, all the testing has to be done. That's the mandatory and a very strict requirement. But I think the second step, and as Ms. Hala was mentioning, we should establish a proper SOP for sanitation. That each facility should decide the requirement of cleaning, the duration of the cleaning based on whatever they can handle with the employers. So a proper standard operating protocol has to be established. And so once they open, and before they open exactly to the consumers, what they can have is a map. What would we see in normal food outlets now? They have a map where the customers can stand and practice social distancing and mark the places where they can stand, and also establish two safety managers, one at the front and the back of the house, both two safety managers who can ensure, because this is becoming so important these days. And as Ms. Hala was mentioning to an earlier question, this is going to be the new normal. This is going to stay with us for a long time. And I'm not mentioning the COVID, but the sanitation procedures, the learnings that we get, it's going to stay with us for a long time. So we cannot afford to be complacent at this point of time, for the personal health perspective and for the business perspective. So two safety managers manning, taking deep control of the front and the back have to be established, and then. All safety, the SOPs that are being developed have to be very strictly followed, even from the customer perspective and from the employee perspective. So these are my points.
We've spoken about before opening. What about once these establishments have opened up? What kind of regular cleaning and disinfection schedule should be ideal for them to follow in their kitchens and front of house?
Normally, it's always required from food businesses. If we talk about food safety management systems, being HACCP, ISO, or any other system, or even from SMEs, not willing to go that much in details, they need a regular cleaning and disinfection schedule. Now, with the COVID-19 pandemic, the schedule will be there, but the frequency will be increased. And we have as well to make sure that we are using the appropriate type of disinfectant. So this is also very important. So the frequency used to be, for example, I'm just throwing numbers, maybe every 4 to 6, 7 hours, I don't know. So now we are narrowing down the frequency of disinfection, specifically when it comes to the highly touched or the more sensitive surfaces, such as the doors, the maybe ATM machines we're going to see later on, anything that our hands are all the time touching. And it's the same case for inside the kitchen. So we should have our crew of food of people are stewarding that are there, and they should be as well trained on that. We need to explain to them the COVID-19, explain to them the importance, everything they should know about it, for them to understand the importance of the frequency of cleaning and disinfection. And this is also the responsibility of the restaurant manager, the owner, to choose properly and carefully the sanitizer they will be actually applying. Is it the appropriate one? Is it functioning properly, destroying the virus? So this is important. What would be the contact time? How long shall I leave it before wiping? Do I need to, for example, rinse with water, etc., etc.?
So training is very, very crucial in this. I mean, getting
Everywhere.
a proper understanding. Yeah, absolutely. Getting a proper understanding of how the virus works, how it is spread, and what are the various touch points, I think would be a starting point for every establishment, whether it's food or not, to understand. Mr. Shabrinath, would you have anything else to add to this?
Nothing scientifically. I agree with Ms. Hala on all points. But one major issue from taking this moment a bit lighter, we don't know the sanitizers that we use. Say, for example, if you go to a shop, they give a sanitizer, you apply it, you're happy. Yes, okay, that's good. But how long are you sure for that? That is sanitizer. It could be just water. So we need to be the sanitizers. They all say 99.9% kill germs. So I don't know. So how long will this work? Will this work against COVID-19? Is this capable of killing all bacteria or viruses? We just don't know. We just are blindly following whatever is there in the brochure, in the label.
Yeah.
So yes, I agree. I agree with this. Very strongly agree that we need to customize a sanitizer for each facility based on their preferences, and then check scientifically against this virus, norovirus, or COVID-19, or whatever the virus is, and then it will help us in reducing the transmission of these viruses.
Correct, absolutely. And we need to be smarter in choosing the products that we use.
Yeah.
Whether it's on a business level or on a personal level. And by the end of it, I think the easiest option is soap. When you're talking about hand sanitizers, it may be a little dicey, but use as much soap as possible every single time that you have the opportunity to do so, right?
Yeah. Yeah. Soap and
We
water,
have
20 seconds. The standard.
Yes,
Yeah.
20 seconds. I remember somebody had told me a couple of years ago, I'd interviewed them for something, and they told me that when you wash your hands, you have to sing the happy birthday song.
Yes,
And
I read that.
that is the right duration for which you should wash your hands, and that ensures that it is actually properly hygiene is properly maintained. And it is pretty amazing, because we visit a lot of shows across the world. And I remember visiting one a couple of years ago, and they had this station where you wash your hands with their hand sanitizer or with their soap. Okay, and they asked me to put it under this UV light, or some kind of a
Mm,
testing technology.
yes.
And although I thought I had cleaned it very well, you could see the germs on this part, near the nails, because that's something we don't really take. So then the five moments of hand hygiene are so important and so crucial when we're talking about a pandemic like this. And it makes it even more apparent for us. I'm
Yeah.
going to go through the next question, which I'd like to ask specifically to Miss Hala. Doctor, you can also respond to that if you'd like.
Yeah.
um, you're in the market, Hala. You are, speaking to clients. You have a huge range of clients across the Middle East. What kind of feedback, what kind of requests, what kind of demands are you getting with regard to food safety consultancy? What is the market wanting to know about?
So for the clients who are already working on food safety management system, now it's becoming mandatory or embedded in the system to have a COVID plan in place, a COVID-19 safety plan in place. So you have a procedure for everything in the food safety management system. You need to add for it a COVID-19 specific procedure. How are you making sure that your facility is actually free of COVID-19 for the time whenever you're starting, and how can you be sure that it will not in the future as well have any contaminated, for example, food handler, or you're having a risk inside. So we are required, if you want, by our client, they are asking us to put this in place. This is when it comes to consultancy services. But we as well have another, if you want, branch, which is the germ control. We are helping them to disinfect the facilities. So we are having this also in place as a service, disinfecting all the facilities before opening as a start, and regularly as well throughout the work, to make sure that we are still working in a safe environment. So it's gonna be, if you want, from two sides. The consultancy service between guidelines and procedure, and you have more the technical part, which is the disinfecting services.
Okay. Dr. Shabrinath, are you seeing any, kind of chatter amongst your students with regard to, food safety and coronavirus? Are you seeing any kind of, demands that they may be having to understand more about this combination of food safety and the pandemic?
Currently, no, because again, this we are all under lockdown, so I have not seen my students for the past 4 months now. So, yeah, so I don't know what they're thinking. They are very eager to return to the campus. So maybe once they are back, we will start looking into sanitizers, as Ms. Hala was mentioning, the basic problem that we have. That is one thing that is there in my mind to check how efficient all these sanitizers are. I don't know whether we can work directly with COVID, because my lab is not specifically set up for it. But at least from a bacterial perspective, we will be checking. Yeah.
So there's been no e-learning or anything at your university till now?
No, we have e-learnings, yes, but
Okay.
we had this e-learning. I think we shut down for the students. At least we shut down in March. So yeah, and it was exam time, and they were entirely different.
Yeah.
Their frame of mind was entirely different. Yeah, yeah.
Okay.
So
Do you see?
Sorry. Yeah.
No, sorry. I was just asking. I know it's off the topic of discussion, but do you see the university or educational institutes also now adding this added level of how to deal with food safety in a pandemic? Do you see that coming up in curriculums in the future?
Oh yes, yes. So we are changing the curriculum from a perspective of food safety, and the food safety is basically so it's so important that the same subject is dealt will be dealt with two different professors, me and my colleague. So my colleague will deal with the management part of the food safety, and I will be dealing with the biological parts of the food safety. So there is so much emphasis placed on food safety these days, and we are also very looking forward to collaborate with different regulatory agencies in UAE to bring about more food safety concepts and how we can implement food safety program, and especially with respect with focus on resistance developed by bacteria when you use sanitizers or when you use an antibiotic. So there is a very concerning development in biology these days, and we are looking forward to work with them.
When we zoom into the restaurant or the hotel or the QSR space, what are the major touch points that hygiene managers should take into consideration, with regards to the front of house? Let's talk about how they need to also maintain social distancing, how they need to regularly schedule cleaning after every person has left, etc., etc.
You have
Hala?
now, yes, you have now a set of guidelines as well, I guess, developed by each country, that
Mm-hmm.
will ask hotels and restaurants a set of procedures to be in place. They start from the receiving of the guests. Queuing is not allowed in a way. We should not have a long queue. You should maintain a social distance between the first person and the one behind you. And they are trying as much as possible to have online booking to minimize the time at the check-in in the hotel. This is one. At every entry point, being a restaurant or a hotel, you need to have sanitizers for the people automatically to sanitize their hands. Specifically, if you're going inside an elevator as well, they are requiring to have inside a bottle of a sanitizer. You can use it before pressing the button. These are some highly touched surfaces. The menu is no longer actually a physical menu. It's not even allowed in some countries. So we can scan it and you can check it on your own phone. This is to minimize as well here. The social distance between the tables, the capacity of the restaurant and the hotel itself. So countries are moving within the phases between 30%, 50%, etc. And the number of people on the table, for example, in some countries, maybe 4 to 5, not allowed more than this. The ATM, how you are paying. So the in the hotel they can't like the car key, the room key, in order not to as well have touching. So we are having a lot of precaution, and all that is documented for the hotel manager or the restaurant manager to be able to cope with all those new normal rules, if you want, because it's gonna be like the doctor said, it's gonna be with us for a while. It's not
Yes.
gonna leave us. We're staying there, until having a clear answer for this virus. We're gonna live with it for a while.
Correct. And possibly even if we do find a vaccine, that fear of something like this happening again is definitely going to stay with us to ensure that we, manage these stringent practices the best way we can.
Yeah,
Right?
yeah.
Doctor, do you have anything to add about front of
Yes,
house?
I think my suggestions are will be applicable to both the front of house and then even the back of house. Because one thing that I would like to suggest to all the food science people who are hearing this session is to use the potency of the UV light for sanitizing their this thing. I mean, I know your concern. I know what you're thinking. The UV light is highly dangerous to our skin. It damages the DNA of the body. It creates mutations. What I'm suggesting is to use the UV lights when nobody is there. Say, for example, if you close a restaurant at night, you can just switch on the UV light for 20 minutes when nobody is there, when everybody has gone out after closing. It can be automated. In many labs in Europe are using the system. So it automatically comes up at 3 o'clock in the morning or so when they anticipate that nobody will be there. When there will be a small siren to, if somebody is there accidentally, they can move out of the room. So, so this will give, this UV light is a very strong sanitizer or disinfectant, whatever you could call it, because it will mutate the DNA of the viruses and bacteria, whatever. A minimum 20 minutes of exposure is more than enough to sanitize. It can be all the restaurants, the tables, plates, and all can be sanitized by UV. Just kept on top. Just one light, that's enough. So that is one suggestion that I can make to the food restaurants and food managers who are attending this session. And of course, as Ms. Hala was mentioning, and all the tables and chairs have to be disinfected every time after every use. That has to become mandatory, and proper social distancing protocol, masks, and all are essential, even for the employee and for the customers who are coming in. And one major concern, which I'm sure Ms. Hala will also agree with me, is regarding the cash register. So the coins that we use is one of the major transmitter of viruses or bacteria. It's a very dirty. If you know what the dirt is there on the coin, you will not touch it. So instead of cash registers, all the process have to be online. All the payments, everything can be online. We have all these facilities these days, and we use that. And if somebody wants to use a cash machine, and as the FDA mentions, you don't give it directly to this thing, you place it on some surface which can be UV sterilized and then can be taken. And after each customer passes the cash register, has to be cleaned. So all these minute, these things will be very effective in providing a very strong food safety culture or food safety environment, and give much more confidence to the customer.
I think we're very lucky that we're in a digital age right now, where we have this option of, going online, doing webinars like this, or making payments online, or ordering online, because otherwise life would have been so difficult. And these solutions are helping us also get into the new normal. We are still going to try and live our life as it was before the pandemic started, and still be able to, try and be as safe as possible.
Yeah,
Um,
it's like this. Life will never be the same again. So
yeah.
yeah, that's true. I mean, what you say is
Before
perfectly
and
true.
after.
Yeah, before and after. So it's completely correct, because it is because of the strong digitalization that we are able to go through this scenario. With this lockdown, yes, digitalization has helped us. We teachers are a particular examples for that. For us, all teaching work was online. All examinations were online, and we could see the students writing the examination. We could catch them if they are copying, even through online systems. So this process, this technology has developed so fast, so advanced, and it was kept ripe for us to use during such a scenario. Yeah.
Correct. So we spoke about the front of house. Okay. Dr. Shabrinath, let's also talk about the back of house. I mean, that's where your major expertise is in terms of food handling and diseases, associated with food handling and stuff. So if you could start and tell us how chefs and stewards need to go about maintaining the strictest levels of hygiene, through color coding, color coded, the cutting boards and stuff, because we do know the virus may not be transmitted through food, but it can definitely stay on surfaces for a while. So, understanding all of that as well. So if you could just give us a short lowdown on the back of house, protocols.
Yeah, this answer is going to take a little bit of time, and also I'll be looking into my notes here, because I just don't want to miss any
That's
points
fine.
that is very important. So I think in the back of the house we have to look for four major points. One is employees health of the employees, very important, because this is a respiratory virus. It can transmit via sneeze, cough, etc. And then cleanliness and disinfection of the facilities, the social distancing, and finally, I think the one point which I don't want to mention here, because I think we'll be dealing with later. So some of these points I have already mentioned before. One is the employees' health has to be monitored on a regular basis. So because the employee could be exposed to this COVID-19 from a different scenarios. You can't explain those things. So the employee's health have to be maintained regularly. If employee is sick, the manager should be notified and asked to go to home immediately. And all other employees who was in contact with this particular person also have to be screened and tested for their for their health. So the pre-screening of the employees, and then and looking for basic symptoms like cough, breathlessness, and other basic symptoms. And also the employees should be self-responsible to see using regular monitoring. And they should always wear masks, of course. That I don't need to say that, but just to mention. And also have gloves wherever direct contact with the food is very essential. And then the personal hygiene of the employees, as we discussed before, wash hands. Hands are very important. Hand safety, hand hygiene is very important. We should wash hands with regular soap and water, with at least for 20 seconds, as you were mentioning about this on. Especially after go to the bathroom, before and after blowing nose, eating, etc. So if soap and water is not available, normal sanitizers can be used. A sanitizer can be, the base of the sanitizer can be hydrogen peroxide or quaternary ammonium compounds or isopropanol or sodium hypochlorite. You have many sanitizers these days. So all these basic sanitizers can be used. And if eventually in a cash register, for example, during that point, if somebody touches accidentally with bare hands, and be careful not to avoid not touching your hands directly to your eyes, nose, etc., because that is a major transmission point. And you have to use gloves to sanitize before we are touching direct, ready-to-eat food products, basically. And one more important thing is wherever we are keeping the food contact surfaces, basically have to be regularly sanitized. Once food is contact, once the processing is over, once it goes to the next step, then it has to be cleaned. So regular sanitization or regular disinfection has to happen at every point of time. And this is the role of the safety manager, who has to ensure that that such proper facilities, such proper guidelines are strictly enforced upon the employees. This is why I mentioned that we need to have a special safety managers both at the front of the house and back of the house. That is very, very important, I guess, to ensure. And as everybody might know, cover the face with tissue if you have an urge to cough or sneeze, and then throw the tissue and wash the hands after you cough and sneeze. So and UV surfaces, the UV lights can be used to sanitize the utensils that is being used before the day starts, or after the day, after cleaning. You can just expose it to UV light. That is a very good sanitizer. And the normal procedures of food safety, like while cooking, maintain the temperature, maintain the temperature in such a way that even the internal portions of the food are heated up for the right period of time, so that all the organisms get killed. And one important point that I'd like to mention is the proper training for the employees. And as I think Ms. Hala was also mentioning it at some point, we need to train the employees. We need to know why they are doing all these things. So it is not just normal training and get a certificate, forget it. No, it's like, okay, yeah, we have a COVID situation. We know that this could transmit through simple sneeze or a cough, and they have to know, they have to be shown why all these things are done, and help customers also in the good infection control by implementing social distancing, like discontinuing operations such as salad bar or any other the buffet beverage counters disinfect, because these utensils will be commonly used, and that could be a problem, lead to transmission, not only for COVID-19, for other foodborne viruses, etc. And encourage social distancing, and then encourage the customers to use sanitizers at each point of time, so that the transmission is reduced. And this again is a role of the safety manager in the front of the house, safety managers. So I think I'm done with yes. These are my recommendations, and the most highest priority I will keep is to use a UV light when the premises are closed. That will ensure food safety to a major level.
Thank you. That was really, really comprehensive and gave us a lot of a better understanding into the protocols that have to be followed. Ms. Hala, any suggestions from your end as well to add to this?
I guess everything was covered, but I would like to add a small detail, which is we talked about training, which is crucial, honestly, to start by educating those food handlers so they will understand why we are asking them to do so. Because sometimes we have a lot of managers telling them just do it without explaining why. And if you don't explain, they will not do it, or they will not do it properly. They will doing wrong without actually knowing the importance of what they are doing. This is one. And we need to remind them. We need refresher at several refresher training for them. We need to post, for example, visual aids for them to remember how to wash your hands, when to wash your hands, when to report illnesses. So it's nice to have visual aids inside the facility for them to remember all the needed points. It's good as well to have, they are asking in some places to have fit teams. If you have a cold section, don't mix the people. Have the same people in the same section as well to minimize exposure. This is also requested in the back of the house as well in the front of the house to have specific teams and not to mix the people. And as an actually a small detail on the gloves. Gloves are excellent, but we emphasize a lot to educate people how to wear the gloves, how to change them, when to change them, because they are forgetting. They are wearing the gloves and touching everything. So this is becoming more dangerous here. So this is a point that will be included in the training, how to change them, how to remove them, how to wash your hands before wearing a new pair of gloves. So that should all the time be repeated in order to have a successful, if you want, plan in your facility. We're not able to hear anything, actually.
No. No, I think you're muted, Shanti.
Yeah, you're mute.
Yeah.
But we can't hear her.
Yeah, we can't
We're
hear
not
you.
able to, although you're unmute, but we're not able to hear you.
No.
Downside of digital era.
Yeah. Yeah, that's true.
This is one of the negative sides. I remember that during the studying of my kids.
Yeah. It's you need to have each every digital platform for each kid.
Yeah, exactly. It's crazy. I hope we're gonna go back to new normal for schools as well.
But again, that's concerning. We don't know, and we are a bit worried. Here we are going to the new normal. Yeah,
Us too. Yeah, they're saying that, but definitely it's a bit unknown, but like all the sectors.
Yeah, that's true. Yeah, we are expecting an email from the school how they're going to do it. Let's see.
Yeah, a lot of precautions as well.
Yes.
Hello, can you hear me now?
Yes. Clearly. Yeah.
Okay, so we were talking about training. So tell me, we were anyway talking about training. So I'm bringing up this question about how the HORECA sector needs to go about training their staff and establishing a code of conduct. We've covered pretty much a lot of the aspects in training, but if there's anything more to add.
I guess as a content, it was covered. And what helps for the COVID-19 is the food safety training by itself. Like Dr. Shabina was saying, the food safety training is requiring avoiding cross-contamination, personal hygiene, cleaning and disinfection. So actually, it's practically the same topics. We are adding definitely the checking for the employees, the routine or the more disinfection in that case. But it should be installed as mandatory. Sometimes restaurants or hotels, they were a bit hesitant about the training. We cannot be hesitant anymore here. It should be mandatory, It should be part of the culture of the people to educate them and train them. Whenever you are installing COVID-19 as a culture, it's like food safety. We always start food safety should not be something that you are doing because I'm here and I'm monitoring you. No, it's a habit that is installed in your day-to-day activity. It's becoming a part of your culture. So it's going to be the same for COVID-19. It's becoming a part of our culture. Wearing the mask, putting the gloves, changing properly, washing the hands, disinfecting. So it's a habit. It's like sleeping, waking up every single day. It's going to be the same for quite a while. And it's not actually something which is negative because it's needed to avoid food poisoning outbreaks as well. So it's 2 in 1 in that case, what we are doing here.
Correct. Absolutely. Doctor, you have anything to add to this? I mean, she said it pretty well, but if there's anything extra that you would like to add?
No, I think it's very comprehensively covered. I don't think I need to say anything at this point right now. It's
In fact, I like what. Sorry. Please go ahead.
No. I was mentioning. I'm done.
I like what Ms. Hala said about training people about why they're doing what they're doing. Because only then would they really know when and how to apply it. If there is a situation that they have to manage because they know why they're doing it, they'll be able to improvise on the go.
Yeah.
Am I right?
Yeah, that's true. I mean, perfectly. Because they understand what they're doing. That's a major thing. And once they understand what they're doing and they do it perfectly, it's normal psychology, I guess. If you know what you're doing, you do it very well. So, and if you don't know, you mess it up. So, so it's like that. I think, that's the point. Yeah, that's very important also.
I'm just going to address the audience a little right now. If you all have any questions, so I'm going to assume that, because we're covering a vast variety of topics through this webinar, you all don't have any questions and they're all being answered. But in case there is something that, you all have to ask us, please feel free to do so. In the meanwhile, I'm just going to move on to the next question, which talks about, catering companies. Is there something that catering companies need to do differently right now, apart from what we've already spoken about? Because they have more of an interaction. I mean, Dr. Shabrinath was talking about, doing away with things like salad bars and buffets and all of that. So how should catering companies change their model a little bit to prevent this kind of crowding or to prevent these kind of buffets that would probably set at parties and events and stuff like that?
The funny thing, in some places or some countries here, we did not reach the phase of allowing buffet. So it's still forbidden, So breakfast in hotels, it's a la carte. They closed this part completely because we have a higher exposure. The utensils, people touching everything, So it's quite hectic when it comes to food safety by itself. It was already a problem, opening and closing the hot dishes. So they stopped it for now, but eventually it will open. Eventually, it's not going to stay closed. So they will have to follow the protocol we were talking about by saying the disinfection. Everything will be the same, maybe with a higher frequency here and a very strict personal hygiene. We talked about it, the mask, the gloves, the social distancing. I guess it should be applicable as well whenever we are ready to move toward this phase.
One of the things that comes to mind is if you're talking about catering companies specifically, you are taking your food and your equipment, which let's assume you've sanitized completely. You've done the UV disinfection, your staff is completely tested, everything. You're taking it from one place and you're going to be setting it up at a different place, right? So how do you ensure with, say, your client or within yourselves to ensure that that environment is equally safe as is your central kitchen? Is there any thoughts on this?
Sorry, I missed the last question.
I said, any thoughts on this?
Yes.
In terms of catering, guys.
Now you have two things to take into consideration. If it's outdoor, it could be easier in that case because the outdoor facility, it's much easier, provided that you have a good weather, etc., etc. Not now for sure, because food safety and the weather now does not work together. But if it's inside and we're going at the client facility, we need to ensure that the facility itself is well clean, the surfaces we are using, the setup. We're going to go back to the same procedures and protocol we are applying in our catering business, and it should take place at the client. And Dr. Shabrina was saying that we need to educate contractor, supplier, and guests. So we need to help them as well. They should follow what we are doing. Otherwise, it will fire back at us. Because if it's in a catering event, they will look at the supplier who did this event. So we should help them to install proper precaution, to say.
And also, I think we need to take care of the food. I mean, I did not mention it here, but the food temperature. Again, keeping our food in the danger zone is very, very important, especially when we are dealing with food with high-fat food, which is mayonnaise, for example. So all these foods can transmit foodborne bacteria, foodborne viruses. So we need to take extra precautions. I think we were a bit complacent at that level until December, and then COVID is coming to remind us that we need to take care, good care, especially in catering or in delivery services too. We should not forget the delivery services. The home delivery services, and we customers also. I'm not talking only about the food managers or the food preparation people. And the customer also have equal responsibility. Say, for example, one typical example is the milk powder. You buy milk powder, and then it is written that you have to prepare it in warm water, but many people don't. So you automatically consider that these are clean. But for milk powder, even though it is given for infants, in many instances there are dangerous pathogens inside. But these dangerous pathogens, if you prepare in warm water, they are killed. So there is a reason why you say that you prepare it in warm water. But when it is prepared in cold water, just to manage the time or something else, you are putting the infant in serious trouble. I mean, it's serious infection conditions. So all these precautionary measures have to be followed, even from a customer point of view. So in my opinion, the training has to be given for the food preparation, for food managers, and even for the customers, because it is a customer who's the final beneficiary and who has to be responsible for his or her own health.
In fact, meat as well is one of the trickiest things when it comes to temperature of preparation as well. You're talking about going beyond the coronavirus. You have your salmonella poisoning and things that, come through. So whether it is the coronavirus or it is anything else, we need to ensure that temperature and food are maintained in compatibility with each other.
Yeah, and there is a salmonella outbreak that's going on in the US right now. Newport. Yeah, so it's again, and I don't know where the world is going. So we need to be very stringent these things. I think worldwide we need to work.
We're so focusing. We were so focusing on COVID-19 that people are becoming less focusing on actually food outbreaks.
Very, very true. There's so many other things that are happening, and we're not able to focus on that because this is, currently taking our attention altogether.
Yeah.
Yes, correct. It's our primary attention now.
Okay, so we move on to the next question. What Dr. Shabrinath has spoken extensively about the concept of UV technology. What other products are advised to be used by staff during cleaning and hygiene specifically in the current scenario?
Okay, so the UV light technology were covered actually properly. We're gonna talk about the regular techniques that we use normally, which is cleaning and disinfection. We even said water and soap are actually more than enough. But when it comes to restaurants, inside, we always recommend the disinfection because it's a very good technique to reduce the number of bacteria to a safe level. We are not sterilizing. We don't want to reach that. We are not working in hospital. We want to reduce our risk to a very safe level in order to actually avoid having food poisoning for the guest or the COVID-19 as it is. So we're talking about our regular range of this detergent, and we're talking about the range of disinfectant. But as I was saying before, when it comes not for a personal use, when we are working inside companies, it's good to look at the material safety data sheet, to read it, because it's giving you an indicator, and the technical data sheet as well. It's explaining how to use this disinfectant, between the contact time, the dilution. It's very important to follow all that to have an efficient result. Otherwise, we are spending money for nothing, and we are not getting a good result. We are not destroying the virus, and we need to take the precautionary measures for the stewarding who are working and using. So we have, from a trade perspective, buying the product as it is, or requesting from companies to do you the service and do the disinfection at your facility. So it can be used both ways. In terms, if you want to talk about chemicals, and we have the regular product, the PPEs for the food handler, from the mask to the gloves, all that should be as well in place, even disinfecting the shoes at the entrance. So we have many things that can take place to help us minimize as much as possible. We always use the word minimizing. It can never be 100% disappearing, you know?
Absolutely. Doctor, anything to add to this?
Yes, I agree completely. We can't reduce it to 100%. It is almost impossible because, first of all, we are not dealing with sterile products. Food comes with its own pack of bacteria. So, and also the only thing is that we can do, as Ms. Hana was mentioning, that we can reduce it to certain safety levels, basically. And as was mentioning, so. I have mentioned this before, I guess, because the different products that different sanitizers, many sanitizers are used. Basically, some triclosan is used as a disinfectant in many cases. It's basically an antibiotic. H2O2 can be used. Quaternary ammonium compounds can be used. Sodium hypochlorite can be used. So all these products all these products have it's ethanol. It's again a great disinfectant because ethanol will just take up water from anything. So it will take up, if you expose it to the bacteria, it just takes water away from bacteria. So this is what is happening. So so all these products and all these base products can help in disinfecting the restaurants, tables, chairs, etc.
We have a question from Mr. Mario Credo. He says, during busy operations, chefs cannot follow social distancing due to small kitchens. I assume he says, doesn't COVID-19 spread from person to person? Because we know that it does spread from person to person. But what kind of protocol must chefs really follow in such a case, especially when you're talking about, maybe QSRs, quick service restaurants, or, smaller restaurant space, or even the kinds that, maybe are the more local, establishments? What can chefs do over there, or the cooks do over there, to prevent as much contact as possible with each other?
Dr. Jabrina said that at the beginning, whenever this restaurant is opening, we are requesting from all the employees to conduct the PCR test. Already, the first step is automatically moving away sick people or even asymptomatic people. So those are on the side. Then we do have in place the regular check for anyone feeling sick, we have fever to be checked on daily basis twice per day for the food handlers. So we are kind of maintaining as much as possible precaution to identify anyone getting sick. That does not mean it's enough. As I started, we have the new normal. So even the chef should adapt to what we call a new normal and should find a way as much as possible, because we understand that a busy kitchen is not as theoretical like staying in the house, people 2 meters away, I can maintain that. Inside the restaurant, the table can be away one from the other. Inside the kitchen, it's definitely harder, but we have to install it as a habit as well. Minimize contact don't exchange a lot of the tools. Thermometers, each one should have his own. That's why we can work about the color coding, maintaining your own set of tools and equipment. It's becoming now required. Don't exchange things. Don't lose your items, and don't take from another section. Sometimes sections are divided by colors to check if anyone is exchanging for food cross-contamination and COVID-19 at the same time. So we need, again, educate our people, explaining to them this new era we are going through that will differ a bit from the old one. And we always have what we call a resistance to change. Whatever is new takes time for us we need to adapt, So, but we should adapt fast because things are moving and we are opening and we are in the last phases of the opening after the pandemic. So we have to be cautious by applying the proper protocols.
Doctor, anything to add?
Nothing much, because I think Ms. Hala has covered everything. That color coding of utensils is a brilliant idea. So yes, I think social distancing is not always possible in a kitchen scenario. I agree to that completely. However, where social distancing is not possible, we can protect ourselves with masks, gloves, maybe PPE to avoid cross-contamination, to avoid contamination of the food. Again, when we do that, you protect the food from other contaminants also. So it's like, as I was mentioning in the first opening answer, that if proper measures are maintained, we can easily control norovirus transmission very easily, because norovirus is transmitted via food and this thing. And so if the food handler is fully covered, then the food is completely neat for transmission. Yeah, neat for consumption. So I think I don't have anything much to add.
The couple of the next questions we've pretty much already covered. So we're talking about the kind of technologies to prevent. So we've already spoken about the menus. We've spoken about ATM machines or card swiping machines and things like that. So I think we can skip that. We've spoken about UV disinfection as well in cleaning and hygiene. Mario Credo says, thanks for the tips. We will discuss this with the culinary team. Again, we've already spoken about the steps taken to ensure the safety of patrons. Everything is to do with ensuring the safety of patrons and staff as well. So we come to the last question. We're already pretty ahead of time, out of time. But are there any other challenges right now that is involved in food safety across the HORECA sector? And if there are any solutions that you all would like to provide?
Sorry, I missed. Yes, I'm reading the question now.
Yeah, what are the challenges?
The challenges of food safety, in my opinion, did not change a lot between before or after Corona. It's mainly one of the questions was actually passing by the audience. It's how to convince people that the COVID-19 by itself has nothing to do with the food. It has to do with people only. So that is maybe the biggest challenge of the HORECA sector. It's to give confidence to the client and the customers and get them back to visit the restaurant, to go to the hotel, to have a successful experience. And we said a lot how to make it easy on them. And I guess time will heal. With time, we were saying when you were not here, me and Dr. Shabrina, how we're going to send back our kids to school. It's the same fear, it's exactly the same. Going to a restaurant the first time was for me kind of a big experience. It has been 4 months I did not go to a restaurant. So the first time I was like, can I touch this? Although I'm in the field and I'm in food safety for 15 years, and I know that I can get food poisoning much more than having a COVID-19 problem, But we've been 4 months through a lot, people, we are experiencing something completely new for us. So it will take us a while to overcome this. Time will heal us, and the HORECA sector will understand this because people will give them chance, as long as you show the customer that you are prepared properly, you are taking all the needed precaution, and they will come, I guess.
Absolutely. I think marketing is a huge aspect of this, where you have to convince the customer that you are the place to go to. You have followed all the safety precautions, and the patron is safe in your hotel or in your restaurant, no matter what. I think that's the biggest challenge, like you rightly said, for the HORECA sector today. Doctor, would you like to add something to this?
Nothing much, because the only challenge from my perspective is we already have all this safety precautions we have, though we don't know much about COVID-19. Tomorrow, researchers may say that, okay, COVID-19 is food transmitted. We don't know. However, However, so we all, from a food safety perspective, we already have all the food safety regulations that is in place. The only thing is we need to implement it more stringently. I think that is the challenge now with the HORECA sector. How are we going to implement it strictly, taking COVID-19 also into perspective? So that, I think that is going to be a major challenge, especially as one of the attendees, one question was there, how are we going to implement the COVID-19 precautions in a kitchen? It's a very practical question. That needs a lot of thought. So this is going to be the challenge for the HORECA sector. But I think we will, as Ms. Hala was mentioning, we will overcome this very fast.
Yeah, absolutely correct. I mean, in fact, so the challenge is twofold. One is for the HORECA sector to ensure that they follow all the rules stringently. They understand the reason why they're doing all of these taking all of these steps. And number two is then communicating that to the audience so that their businesses start flourishing again. Right. So on that note, we are going to end the webinar. Thank you so much, Hala and Dr. Shabrina. Thank you so much for being such a great panel. We learned a lot, I think. In fact, I learned a lot as well from both of you. And thank you so much for being part of the panel discussion. Thank you so much to the audience. And I would like to also thank our sponsor, that is Boecker, for sponsoring this session. I think we've got a lot of information out of this webinar. So we're going to say our goodbyes now. Thank you so much.
Thank you. Thanks a lot.
Bye.
Thank you.
Bye-bye.